Dear students, we'll discuss a topic which is quite common, an infective condition. Just see here, thigh, so much necrotic area, so much with redness. See that edema is there. Edema is extended downward, so much. See that. So small multiple openings are there. So what this condition is? So it is maybe carbuncle. So that muscle is not involved. Polymyositis, that is infection of the muscle. Muscle is not involved here. So you can see that multiple are there. So it is common in diabetes, common in immunosuppressor. Infection is common. You can see the edema there, extension downward. So there will be toxic, high fever. They may have decreased urine output. Kidney may be involved. Liver may be involved. There may liver function may be altered. There may be having a breathing difficulty because it's systemic toxicity. They may go for a septic shock. So all these features will be there. So reduced urine output, breathlessness, desaturation, altered liver enzyme, creatinine may be altered, so potassium may be high. So they need to monitor, admit. Initially they may require a resuscitation like start fluid, start antibiotic, give oxygen. Sometimes they may go for a ventilator, intensive care unit may be required. But important thing afterwards, because there is a source. So source control, once you start antibiotic, broad spectrum antibiotic, initial resuscitation, everything, then the source has to be controlled. So once it literally better, then immediately you have to drain this one completely. Everything has to be removed. Usually under spinal anesthesia, extensive wound debridement, send the pus for culture and sensitivity, tissue for tissue culture also. Extensive debridement is required. Entire area may be removed, has to be removed until all pus infected material comes out. Then you give it a very good wash through the warm saline. Then you put the dressing, and regular dressing is required. And meantime also maintain the urine output. Sometimes they may require a hemodialysis, then albumin infusion, higher antibiotic, blood transfusion, IV fluid management, cardiac management, systemic management. Everything is required. Sometimes total bending nutrition, of course, orally you can give. Proper nutrition, high protein diet. Don't allow them to go for catabolic status. If you can control the sepsis, get the kidney back by initial immunization back for normal function, get the liver back, and control the sepsis, control the toxemia, and local regular dressing, proper antibiotic, maintain the nutrition, maintain the blood features like hemoglobin, blood count, platelet count, all those things, and bring down the creatinine if it is high, maintain the urine output, maintain the nutrition. All those things are important in this patient, and regular monitoring with the total count of CRP, creatinine, LFT also important. All these things, again, Doppler study, there may be DVT also, there may be necrosis also, because these things are happening very close to the femoral vein. So femoral vein may go for a septic thrombosis, may throw an emboli, may suddenly kill the patient. So all these things has to be diabetes, if that should be managed by a physician's help. So nutrition, antibiotic, entire thing management, resuscitation, critical care management, cardiac management, liver management, kidney, everything. Everything is important. But once they settle down, it will granulate very well. And once it granulates well, usually split skin grafting has to be placed over that. So reconstruction, wound cover after that is also equally important in this patient. So necrotizing fasciitis definition is here. Skin fascia is involved, soft tissues are involved with extensive destruction. Commonly streptococcus, can be multibacterial also, polybacterial, monobacterial. Commonly polybacterial, but begins with the streptococcus infection. Then of course gram-negative and other infection can occur, and fungal infection rarely can occur. It's rare, of course. So if it's a short note, necrotizing fasciitis, remember LRINEC. There is again MCQ question. Laboratory risk indicator for necrotizing fasciitis, it's grading, what are the parameters, everything is there in this LRINEC risk factors. This is very important. MCQ question, theory they will ask, Viva they will ask, Oxy they will ask, NEET exam or your university exams and complete exams, so this will ask. So this you should remember this LRINC factors actually. So that is, all these things are important. Drainage, critical care management for this patient. They need a long hospitalization, large antibiotic coverage, dehydration, fluid therapy, everything, blood transfusion, albumin therapy, parenteral nutrition. So all these things are very crucial. So long-term hospitalization is very, very important. expense also very crucial, very, because they need a lot of economic backup to treat such patients. Diabetic management also equally important. So everything detail about this chapter is there in my chapter, manual of surgery infection. So go through that for your better understanding of necrosis fasciitis, abscess, carbuncle, all those similar conditions. So you should know the proper difference between each, so that you will have the clear idea, so that you can face oxy, short notes, viva, clinical cases, everything. Students, I again request to please subscribe my YouTube channel. Also share with your friends and colleagues. Press the bell, and which will update your knowledge about images, instruments, specimens, X-rays, of clinical cases regularly, and operative procedure briefly. So also join live session. Regularly comes once in 2 weeks, where student will present a case which is very useful for your long case, 1.5 hour discussion with in detail presentation about the case, baby hernia, mass abdomen, or vascular disease, varicose vein, thyroid, breast, and so on. And if you join, you will get a certificate which will be very useful for your future. Request again to join live session whenever it is there. Earlier live session, please go through that, and earlier lectures also, please go through that, and join and subscribe my YouTube channel and share with your friends, and answer the MCQ. I'll appreciate your answer, and put it in the comment box. SN regimen is used in ABCD. Put the right answer. Another MCQ, erysipelas disease is also called as ABCD. Again, find out the right answer. Put it in the comment box. I'll appreciate your answer. Quotation of the day is silence and storm are two things essential for success. Again, very, very useful in surgical practice, because surgery is sometimes major surgery becomes a storm. And when you take a decision, better think silently. That's what exactly it meant. Students, again, I request, please go through my YouTube channel, and also subscribe it, share with your friends, and daily review the YouTube channel and join the live session. And also have my manual of surgery and clinical method in surgery to have a best knowledge about different surgical aspects as per oxy, or knowledge as such, with the quotations, illustrations, photos, everything. Students, I hope you understood this lecture very well. Thank you so much.